Delegation is a critical nursing skill to have. I am Adele McFadden, and I will be discussing delegation and the nurse. Delegation is defined as when a nurse instructs another person to perform nursing tasks. This involves at least two people, a delegator and a delegatee. The delegator trusts that the delegatee can accomplish the task and report findings back. This also requires empowerment of the delegatee to accomplish the task. If the nurse does not delegate appropriately with clear expectations, there will be wasted time because they will have to check and redo everything someone else has done. So how does the nurse know what to delegate? Well, the American Nursing Association has developed the 5 rights of delegation to assist nurses in making safe decisions. First is the right task. Registered nurses are responsible for assessment, planning, and evaluation within the nursing process. These actions should not be delegated to someone who is not a registered nurse. Second, right circumstance. People who are or may become unstable in cases with unpredictable outcomes are not good candidates to delegate. 3. Right person. Before delegating a task, the registered nurse must know the delegatee's job description and previous training. 4. Right supervision. Nurse Practice Acts require the registered nurse to provide appropriate supervision for all delegated tasks. Registered nurses are accountable for evaluation and the overall patient outcomes. 5. Right direction and communication. All delegators must communicate performance expectations precisely and directly, and comprehend what, how, and when to report back after the delegated task is complete. The Nurse Practice Act established the standard that each licensed nurse is accountable for the safety of nursing care. Each state jurisdiction has different laws and regulations about delegation, and it is the responsibility of all licensed nurses to know what is permitted in their state NPA rules, regulations, and policies. In delegating tasks to another, it is important that the nurse knows the capability of the worker, making it the nurse's responsibility to make sure that the delegatee is competent to perform the task assigned. According to the National Guidelines for Nursing Delegation, it is the nurse's responsibility that is based on the needs of the patient, the stability and predictability of the patient's condition, the documented training and competence of the delegatee, and the ability of the licensed nurse to supervise the delegated responsibility and its outcomes, with special consideration to the available staff mix and patient acuity. Now that you know what delegation is and how to do it, are you ready for your next shift?